Soon after my third child was born, we found that she wasn't meeting the gross motor milestones. After many specialty visits, a different kind of diagnostic tests, we discovered that she had a rare coordination disorder. Maybe there's only 4 or 5 kids in the country that have what she has. It kind of spiraled us into this new journey that included a lot of therapy, specialty visits, becoming an expert in what she had and what we could do to help her.
My son had a very extended stay in the NICU, or neonatal intensive care unit, and has had some sequelae, just as a result of his prematurity, kind of primarily related to some chronic lung disease and some developmental delays. He has a lot of different specialists, maybe up to 8 or so. On a weekly basis, he does speech therapy as well as physical therapy to help him help catch up to his peers. We spend anywhere from 2 to 5 appointments each week.
If you have a choice of a sick family member or a career, many of us would find it necessary to take care of a sick family member.
The Doris Duke Charitable Foundation recognizes that problem, recognizes that risk, and has developed this experimental program designed to support these physician scientists that are in the early career stage, support their research so that they don't have to give up research simply because they need to care for their loved ones.
My research is focused on global health, prevention and epidemiology of childhood pneumonia, of childhood diarrhea. And during recent months, we've gotten into understanding Zika infection. So I primarily work in Nicaragua. I'm constantly writing grants, writing papers, doing the research and presenting it at research conferences. So there's quite a bit of travel, and it's a very demanding job.
My research kind of really is at the intersection of oncology, psychiatry, and palliative care. And what I am mostly focused on these days is looking at how parents with advanced cancer make decisions about their advanced cancer treatment and how that may differ from individuals who do not have children, as well as looking at trajectories of their psychological distress, meaning their anxiety, their depression, their quality of life, and how that may differ between these different patient groups over time.
Before I had the Caregivers Award, I would spend a lot of time in the waiting room, during a therapy session, just, writing a sentence, writing a paragraph, trying to get a grant written. But it's not the best way to do things. It's better to have a block of time to really delve deeply into what you're focusing on and being able to write a great grant. And so this protects one day of my time so that I can just focus that day on writing grants. And with my collaborators here at UNC, we've written 6 grants in these past few months. But unless you can have the time to do that, you can't stay in the research field.
Having a research assistant has been, I think, critical to helping me be able to pull off any of this balancing between being a parent and a researcher and a physician. The kind of research I do is clinical research. It's very hands-on. It involves these interviews as well as surveys with patients. It's the kind of research that has to be done here in the hospital, in the clinics, and there's no replacement for a human in front of you to discuss what the study is about and enrolling you into these 10 studies for these trials, but also to actually conduct the study activities.
We didn't want to ignore the others who didn't receive the funds, and we wanted to build a cohort. And so our program involves all 21 of the applicants in this first year, and we will continue to grow that cohort every year as we request more applications to participate. We don't want to lose these top-notch scientists simply because it is too hard to keep your research going when you are also a clinician and you are also facing substantial caregiving demands at home. So we're going to retain them in science, and that's huge. The funding is not for them to hire caregivers for their loved ones. They want to care for their loved ones. The funding is to support their research so that they can do that.